Welcome back to Face the State. I'm Arianna Bennett. Thank you for keeping it here. When it comes to attracting people from specific fields to work in Nevada, there's a program at the college level that serves as a useful tool. The Western Interstate Commission for Higher Education, or WICHE, helps students pay for programs that'll help bolster fields where we have big shortages, like healthcare. So Fred Lokken and Patty Porter with Nevada WICHE are here to talk about that. Thank you both so much for coming on the show.
Hi. Thank you.
Great to have you. Now, Fred, obviously you're no stranger to Face the State, but usually you're here talking politics. Today you're wearing a completely different hat. Tell me about that.
Still have a big hat, so hard to find the hat that fits. Well, this is I've been involved in a lot of agencies and commissions throughout my professional life. This is the most recent. I'm now in my 10th year on this particular commission, and we're doing some very exciting things, so I'm very excited to be in it.
So for those who aren't familiar with WICHE, can you give us a little primer, either of you, of what it does and how it works?
Patty?
Well, the Nevada WICHE, which is, I think a lot of Nevada residents probably don't know, is Nevada joined the Western Regional Compact in the late 50s. And when they joined, they made a commitment to participate with other states in the Western region. And part of the programs and the benefits that come out of that one, which a lot of people know about WUI, the Western Undergraduate Exchange. They may not know WICHE, but they know, some will know WUI.
Yeah.
And so other things though that WICHE does, Nevada WICHE does, is that we have stipend programs, and we provide funding for Nevada residents to achieve or fulfill their these professional programs that we need in, like you mentioned, in the healthcare fields. What we wanted to highlight today was, besides those programs, were a new one, which is a partnership with Utah State University and their College of Veterinary Medicine.
Mm-hmm. Yeah, it's really cool. So correct me if I'm wrong. Essentially, we are helping students pay for tuition in programs that may or may not exist in Nevada. In return, they have to come back here once they graduate to work here for a specified amount of time.
Correct, and in each of the cases of these programs, they're critical needs. We're dealing with the great shortages in the state of Nevada. I've always described WICHE as a quality of life organization. It works that way in every state. It's trying to build up the professionals you need. And if we were in the 1950s, it would have been medical doctors before the med schools got started here. We've had dentists. We've covered all the professions that are part of that fabric of a quality of life. And we've done such a fantastic job on the West Coast that we're all in a much better spot. But each state still deals with certain shortages.
Yeah, we've been dealing with these shortages for a long time. This is something we've reported many times when we're talking about the healthcare sphere. Mm-hmm. And so WICHE covers nursing, occupational therapy, a variety of healthcare fields.
Mm-hmm. Actually, so for our professional student exchange program, which is a partnership with Regional WICHE, we cover occupational therapy currently, physical therapy, pharmacy accelerated 3-year, physician assistant, and actually we do have 4 slots in veterinary medicine in the Western region. So that's for PSEP. For HPEP, which is our health profession education program, and which is solely run by our office, still funded by Nevada, is registered nurse program. We have advanced nurse practitioner and masters in social work.
Yeah, and all fields that we desperately need. Mm-hmm. Okay, so tell me about the veterinary medicine one. This is brand new. It's interesting. How did this come about?
Well, this discussion has been underway for more than a decade between Nevada and Utah. State Senator Pete Goicoechea is, I would say, the architect of this. He got things going for us, introduced legislation in 2023 that was ultimately supported unanimously by all Republicans and Democrats, signed by the governor, that gave us $8 million to run a 10-year program funding up to 70 students that would be Nevadans that could be selected into the program at Utah State and have their out-of-state tuition covered. As you had explained, in return for each year they accept the stipend up to 4 years, then we get up to 4 years of service when they complete their degree. That brings this talent back to the state, and then we're hoping that they'll like it so much here that we get our permanent and improved number of veterinarians.
It seems like that works fairly well because we're a great place to live. And you hear that from people who have a reason to be here when they come here from out of state. I'm hearing it more and more, especially in the healthcare field, which is great to hear that people really like it here, but we have to get them here to begin with, which is challenging.
And it's especially challenging in places like the rurals, where they're not as excited to be. They feel very isolated. And And so we're taking that challenge on as well, because we have 3 regions that we look at, the southern part, the northern part, and then the rural part. And we want to have success with these new veterinarians in all 3 regions.
So I'm understanding how Nevadans benefit from this. How does Utah benefit from this?
Well, Utah State, what they benefit is they're in the process of obtaining full accreditation. And so they are looking for partners, just like Nevada is looking for a partner. They in turn want to get more veterinarians in their state. And they started actually with the 2+2 program, which was USU and Washington State. And then built upon that success, they are now doing their own vet school. And in standing this up, they want to look to us as a neighbor to provide opportunities for our residents to be able to benefit from this new vet school. They are very similar to us as far as areas of rural need, and also in the urban areas as well. And so they feel it's a win-win. We're investing in them and their program by the $8 million allocation. And in turn, they're paying the difference for our residents for in and out of state tuition to attend and make that commitment. We also have a very tight relationship through this whole process. We're involved in not just giving money to our residents, but also to support them, and looking at programs like how can we better mentor these students while they're going through school, and then as they get ready and come back. For example, between the 3rd and 4th year, they're going to do a distributive model, so their clinical rotations will be in Nevada, and some outside of Nevada. But the goal is to try to get them to come here and experience here and stick here. Just as much as you probably hear the concern about medical residents, they leave our state and they stay where they do their residencies. So we want them to come here and still stick with Nevada.
Yeah, that's a topic I've covered on Face the State several times, this lack of residency programs. It's leading to a further problem in our healthcare shortages. So this $8 million was, state funding?
State funding.
Okay, so one-time allocation. When it's gone, what do we do?
Well, we're hoping that we have a fantastic story to report back to the state legislature. They'll be monitoring over the next 10 years. And we can't guarantee that every student that's going to start is going to be finishing, but we'll be monitoring that and building the program. We're also going to try to create it to be more sticky. For Utah State, we become a pipeline for students as well, which is they are starting with 40, I think a class of 40 this fall, but they hope to double to 80. They are looking for us to provide those numbers of students that they need, because they have a critical shortage as well.
And we have 2 takers already.
Yeah.
Yes, we do.
We had a very short window of just a few weeks, and we were able to get several applications into the pipeline, and 2 met the expectations of their program. So yes, they'll be the pioneers this year, but we are hoping for a much larger number for the fall of '26.
I feel like the interest is definitely there, but there are not that many veterinary schools.
No, there aren't, and how you get there in the first place is, we are working with the Nevada System of Higher Education, the 2 universities, the State University, and 2 of the community colleges, to try to create pipelines within the state that will bring them up prepared to meet the standards for entry. And we're cooperating with the Nevada Veterinary Association. We're trying to develop as many partnerships as we can. We see it as a team effort to ensure their success and to ensure our success of addressing this critical shortage across the state.
Now, the students in all of your programs, do they have to meet academic requirements of any kind in order to continue to receive the help, or how does this work?
So if a person is certified, so part of my role is to make sure that I certify them on behalf, I'm the certifying official for the state of Nevada, so I have to make sure that they are Nevada residents. So the requirement is 1 year prior to application, and that they've been admitted to their professional program. Based on that, then if they are selected, they actually fill a contract out. They sign a contract that has an agreement and a promissory note, because here's the thing, if they don't fulfill their service payback obligation, it will convert to a loan with penalties and interest. So we want people to be serious about receiving this funding, but we also want to, it's not our goal to convert, our goal is to help them get through, support them, and have them come back to our state and serve here.
How many students do you have overall in all the things?
Gosh, I would say right now probably we're funding probably somewhere around 70 to 80 a year, and then and because our programs vary in numbers, so for example, vet med is 4-year program, PA is 2 years, PT, which a doctor program, is 3 years. So they're all kind of, I have students leaving and entering the programs at various times. So the job of our office is to not only solicit, certify and award, but also to make sure they're in compliance and they're progressing, like as you mentioned, that they're maintaining satisfactory academic progress and that they're progressing in their coursework. And then when they graduate, we follow up with them to make sure that they come back to Nevada, that they're being employed. So I have to verify things that come along the way that they are enrolled. They're in, for example, a Nevada veterinarian and a Nevada hospital, and then we track them throughout until they fulfill their commitment.
Yeah. So then, WICHE's been around a long time, obviously. Has it always been healthcare focused, or has it shifted a lot over the course of its history?
It was based on quality of life. That's where the discussion started. We were the first approved compact by Congress. And the irony is we used to fund attorneys. We could have some jokes about that at the expense of our dear colleagues in law. But no, it was very much wide open to each state to kind of decide what that professional shortage represented. And then as we grew and became, the list began to shrink. And now the PSEP program is a relatively small program, but it used to have well over 10 to 15 different professions. So we've been very successful. We're very happy about that.
So then we have veterinary medicine added. What's next on the wish list for, careers that we're hoping to bolster here?
Well, we have a 3-member commission, and we've really been doing a lot of strategic discussions about that. We really would like to be able to help address everything from the nursing shortage to possibly even our teaching shortage. All hands on deck. We are so far behind on that loop that we really need to generate as many creative ideas as we can. But it has to be a dialogue with the legislature, the governor's office. It has to make sense and be a fit. So we're like in the groundwork stage of just finding out if others have better ideas. We certainly have had a very extensive relationship on physician's assistants, for instance. They really are filling a need, and we can get more of them in place faster than medical doctors, for instance. So we're trying to find ways that just ease the critical needs that we have across the state in a variety of areas.
Interesting. Okay, well, cool. Are you at all concerned about a loss of funding? I don't know how much of your funding comes from federal sources or state sources or places that everyone is tightening the belt right now.
Well, the legislature is the source for our funding on these things.
All of it?
Yeah.
Oh, okay.
Well, actually, yes, our base budget appropriation is what, you mean.
Yep.
And then we also do have funding from loan repayment revenue, because this office used to do stipends and loans. And then in the 2021 session, they eliminated the loans, so we only do stipends. But we still have loan repayment revenue coming in, and then so that helps us a little bit with that.
But it's diminishing. But the idea is to it's seen again as a bipartisan, well-supported program since its inception. Everyone sees a value to it. We have 4 members of the legislature that serve as an advisory committee for us to make sure that we're accountable and we are very visible, and I think the relationship is strong there. The idea is now to discuss ways of expanding that, but we are limited in staff. We would also have to see additional staff to make that really work.
Yeah, it seems like a logical solution for a problem that most people experience regularly. Okay, well, we just have a little over a minute left. What's your message to someone who might be out there either considering applying or interested on behalf of someone else?
So if there's someone out there that's interested, has questions, they can check our website out at nvwiche.nevada.edu. We have a contact us form page. Our phone number is on there. All descriptions of our programs that we mentioned today, I mean during this time together, is there as well. And I'm always happy to talk with somebody individually and guide them. If I can't help them, then I try to refer them to other programs in the state, loan repayment revenue programs. I don't like leaving people without something. So I encourage them to contact us.
And we have a September 15th deadline for 2026 fall at USU.
Yeah.
So if you're interested in vet, call us soon.
Do it right away. All right, you two, thank you so much. Really appreciate your time.
Thank you.
Thank you.
Well, that is it for this episode of Face the State, but for more information or to see past episodes, you can head to 2news.com. Thank you so much for being with us. We'll see you next week. It is a hike.